Okay, so this is an important topic and has been asked in your different exams, right? Cerebral hemorrhages. Now there are topics are mainly EDH, SDH, SAH, intracerebral hemorrhage, right? These four, and alternately this has been asked in your exams. Like once they have asked EDH, then SDH, then next year SAH, then ICH. So we will discuss about everything from this one only, from the slide that you are seeing with the images, right? So first I will see this one. First let's see subdural hematoma. I will take another pen. Yes. Let's take EDH first. It's really easier for you. See, this is the hemorrhage, right? As you can see, just follow my pen. This is your EDH, right? And you can see this is a biconvex or lens shaped. This is between dura and the skull, and this is the important point: tearing of the middle meningeal artery due to a high velocity impact in adolescents and young adults and trauma, right? And also I would like to add here that there is associated lucid interval. What is lucid interval? It is the period of consciousness in between two periods of unconsciousness. Two periods of unconsciousness, and in between the patient is conscious. What does that mean? Like when the patient has faced RTA, he is unconscious at this point, and then he gains consciousness, walks to the emergency department and becomes unconscious again. So the period of consciousness where he was conscious and walked to the emergency department, in between the periods when he was unconscious, there is this period is your lucid interval, the period for which he remained conscious. And this in epidural hematoma we see lucid interval. In SDH, where it is, yes, this one we also see lucid interval, right? Okay. So here management is surgery. Management is surgery. When we will do surgery? When the clot size is more than 30 cc, midline shift is more than 5 mm, or thickness is more than 1.5 centimeter. What is midline shift? I am showing you. See, this is your midline, right? One second. This is your midline, but see there is a you can see this diameter of the brain is little shifted, right? There is not a good picture, otherwise I would have shown you. The matters of the brain are little shifted from the midline. You can see that the part where there is hemorrhage, this shifts the diameter of the brain to the opposite side, right? I have to show you a better image. I will try to show it in another image, right? Anyway, so this one is your EDH. The bleeding is of biconvex or lens pattern, right? So we will revise EDH again. So EDH, I already mentioned that it mostly occurs in young patients due to high velocity impact. There is lucid interval, which is the period of consciousness in between two periods of unconsciousness, and the hematoma is biconvex or lens pattern. Management is surgery. More than 30 cc clot size and more than 5 mm midline shift, more than 1.5 cm thickness are the parameters to undergo surgery. And there is a particular named incision for EDH. It is the bar hole incision, correct? Bar hole incision. Now in EDH, this is about EDH, right? Talking about SDH, I will take another pen. This is your subdural hematoma, where there is the collection of blood between dura and arachnoid matter. Alcoholics and elderly are the prone, and tear is there in the bridging veins. Very important. Actually, more precisely, it is cortical bridging veins. It is a venous bleed. Epidural hematoma is arterial bleed, right? And subdural hematoma is a venous bleed. Important, right? So NCCT shows concavo-convex pattern. See this one, right? Concavo-convex pattern between dura and arachnoid, bridging veins involved. Here is also management is surgery if the bleed is more than 1 cm thickness, midline shift is more than 5 mm, or there is fall in GCS, right? That we have mentioned in NICE guidelines. Anything is there, right? So this is all about SDH, right? Now also I will like to mention that the brain injury is more in subdural hematoma than extradural hematoma, right? Now talking about SAH, so I will take another pen. this one. Nice. This is your subarachnoid hemorrhage, this one, right? So there is blood in the circle of Willis, cisterns and fissures, and the involved there is a rupture of the berry aneurysm. See, this mainly occurs due to berry aneurysm rupture, but trauma is also a factor. Okay? Trauma is also a factor. And the next image is our intracerebral hemorrhage, right? We have to take another pen. See, this is your intracerebral hemorrhage. Which one? This one. So this is a hypertensive vasculopathy. This one you have to remember. And the most common site of hypertension, hypertensive bleed is your putamen. This also has been asked. So remember all these points that I have mentioned. We will see another picture. We will see another picture. This one. Yes. Let's see. Yes. So same thing is mentioned. I will just like to highlight the pictures here. See, this one is EDH. Now you can easily identify. This one is your EDH because a lens shaped. See, this is how it pushes, right? It pushes the midline in. See, this is how it pushes, right? The gray matter to the other side. This is your what we say. One second. Yes, this is how it pushes the gray matter towards the other side, and what we say as the midline shift, right? So this pattern you see like this. This is your concave or convex pattern hematoma. So this is your subdural hematoma, correct? And this is subarachnoid hemorrhage. You will see it. Yes. See, there is bleeding over here in this portion. The arrows, see the arrows. So this is your subarachnoid hemorrhage, right? And when the bleed is here in your putamen region, globus pallidus, putamen, this is in the side there is internal capsule. I will show you in the anatomy of the head, right? So there you can understand better. So this is your ICH. The site of the bleeding is putamen because it is mostly hypertensive bleed, right? So this concludes the session. I hope you can identify the hemorrhages now. Just try to identify the images. If bleed is here, it is mainly ICH. If bleed is here, it is subarachnoid. If the bleed is your lens pattern or biconvex pattern, is your EDH. If the bleed is banana shaped or concave or convex pattern, this is your subdural hematoma or SDH, right? And next we will discuss about goals of treatment of head injury, Glasgow outcome score, and brain death. So we will meet in our next session, right?